So can you tell me a little bit about what happened today?
Oh, I was lifting something and I was turning around while I lifted it and I just felt a bit uncomfortable at the time, and then it just got quite bad after that.
Okay.
And now it's just really sore.
Okay, alright, so you didn't actually fall on the floor, you've just lain down yourself?
No, I just lay down.
Okay, alright, great. Well, my offsider has already taken some odds of carrying going on, so now we're just going to carry on with a verbal and physical assessment of her. So what I'm going to do is, first of all, I'm just going to put this chair here and I'll get you to pop your legs up on it so you're feeling it, just to take the weight off your back while we're having a chat. Now ultimately with back injuries, they're really common and most of the time they're not serious. So what we're wanting to do is we're wanting to get you up and moving around. I know it's probably not something you want to hear, especially when you've got a sore back. Good. So initially, where our concerns with back pain, there can be many different causes for back pain. These include musculoskeletal issues. Sciatica can be a really painful one. Tumours can spread to the spine. Infection can be another one. Spinal fracture. A serious one is called equina, so that is compression of the nerve bundle. So we really want to ensure that none of this is going on. Okay, in terms of your bowel and bladder motions,
Everything's fine.
okay. When you urinate, have you had any pain?
No.
No pain when you urinate? Is it normal colour?
Yeah.
Okay, and you're able to stop and start?
Yeah.
Okay, great. In terms of bowel motions, when was the last time you had a bowel motion?
This morning.
This morning? And what was it? Was it watery at all? Was it normal for you? Normal for you? Great, okay. So that's one of our red flags, is loss of bladder or bowel control. Now, another one is temperature over 38 degrees, which Karen doesn't have. She's sitting at 36.7, so we're happy with that. Have you been sick recently?
No.
No? You had no general feeling of unwellness?
No.
Okay, so no rigours, no shakes?
No.
Okay, again, so abnormal vital signs, rigours, general feeling of unwellness. Those are some other things that we are going to look for through our red flags. Do you have any pain in your thoracic spine? So by that I mean between your shoulder blades there, or any in your chest at all?
No, it's all
No
just
chest
down
pain?
the side.
Just down in that spot. Okay, great. The other thing is, do you have any altered sensation in your saddle area? So when I say saddle area, I mean, imagine you're sitting on a bike, and where the bike seat is, where your body comes in contact with that, sort of there. No numbness, no tingling, no altered sensation?
No.
Okay. Do you have any pain shooting down the back of one or both of your legs?
No,
Okay.
it's just in that spot.
Alright, so that's covering sciatic. Alright, and also called it equina. And in terms of being able to walk, when you experienced that pain, were you still able to walk and lie yourself down, or did you have to...
Oh yeah, no, I could still walk around. I just was more comfortable lying down.
Okay, great. Alright, cool. So we've covered up our red flags. So I'm happy that I can carry on with examining Karen and just really encouraging her to move. Other options that we may want to consider looking at are things like a history of cancer, obviously spreading to the spine, other than skin cancer. If our patient is immunocompromised and taking any steroids, but we're happy that Karen's not on any medications. Worsening pain, especially when lying down or at night. Recent unplanned weight loss, pain radiating down, or altered sensation or power in either of her legs, osteoporosis or IV drug use. So now what I want you to do, before I get you to move, the other thing I do want to do is just have a feel and a listen of your stomach. Are you happy for me to do that?
Yeah.
Okay, great. So we're just going to also take Karen's abdomen. We're just checking for any hard masses that we can feel, and I'm also going to be listening for any bowel sounds. So I want to know that there's gas sounds still happening, which means that we've still got peristalsis happening, and we've still got movement in the abdomen. So I'm just going to listen. Alright, so before I get you to to move, I just want to feel, I'm also going to feel for a pedal pulse on both sides. For me, I'm just going to run my hands down your legs on both sides. So can you just tell me, can you feel that? So, Karen, we've got some pain relief that I can give you.
I've had some essential oils. So
You've had your essential oils. Karen's had her essential oils. She doesn't feel like she needs pain relief now. She appreciates and understands the reason for the pain and that we want to get her up and moving. So that's fine. The information sheet I give you later on will cover more about analgesia. Good job. So what I'm going to do is I'm just going to have a look at Karen's back, and what I want to do is check for any redness or swelling. I want to see if there's any, or feel for any muscle spasm. Now, did you say it was this side, Karen, that was sore? Okay.
Yeah.
So I can't see any swelling or redness. I can't see any spasming muscles at this stage. I also want to just do a quick check of your kidney. So what I want you to do, Karen, is I just want you to push yourself up with this arm, and you can just take your time. There's no rush, but the goal is to get yourself sitting up. That's it. Obviously, we don't want to rush our patient. You can take your time with this, but they do need to be getting themselves up and moving. So we also want you to stand up, so if you can, and I can help you with this if you're alright. So another thing I want you to do is, I know it's probably going to hurt, but can you bend down and just try and touch your toes? Yeah, awesome. Well done. Okay, so no shooting pain down your back there?
No.
That's right. What I've got is this patient information sheet that I'm going to give to Karen. This is going to tell, just fill her in about the red flags and what to look for. If you do experience any of those, call us on 111.
Okay.
Otherwise, if you have any other symptoms or it's not getting better, or you would just like to go see your GP or your physio, they can help you if you'd like some further advice or assistance.
Okay.
There's also a healthline that you can ring number on there. There's a wee bit of information around analgesia and how it works in terms of ladder, stepping into it, and also a little bit about the condition itself and just the prevalence that lower back pain has, and that ultimately the best thing for you is to get moving. So we want you to be doing about 20 minutes of exercise, walking a day as a goal, and ultimately you want to get back into your normal active routine as quickly as possible.
Okay.